Hello again, everyone. Welcome back to episode 3 of Skin Identities. Today we'll be talking about people's experiences with Hidradenitis Suppurativa or HS through multiple studies we will be reviewing today. We will go through what they feel psychologically and physically, and this could include their experiences with the healthcare system, socioeconomic, or any other reasons that could have either been a barrier to obtaining HS treatment or a barrier that HS is to their life. We will identify any similar themes we see throughout the studies I have researched today, so I hope you guys enjoy. So just as a little recap to HS, or if you're starting at episode 3 for some odd reason, because fair enough, I do that sometimes, it is a chronic inflammatory skin condition characterized by constant boils, nodules, and abscesses that eventually build up in a purulent discharge or more often than not scarring. Now that we have that out of the way, what are people's personal experiences when combating HS in their daily lives? Well, when looking through all the studies, there are a couple themes that have come out when comparing the experiences, barrier and cost of having HS, which I will list now. First, there are the associations between job stability when it came to HS, activity and employment, impaired social life and love life, access to proper care and specialists that is patient-centered, inclusive, and obviously hoping that they don't get misdiagnosed at the same time. The relationship between disease activity and employment for individuals with HS is bidirectional. On one hand, HS symptoms such as pain, discharge, and odor can lead to frequent absences from work and school, as well as interruptions for medical appointments during flare-ups. The severity of HS can influence career choices, with many individuals opting for jobs that avoid prolonged sitting, frequent walking, or in-person attendance to prevent worsening their symptoms. People impacted by HS have said it inhibits the progression of their career, as they are at risk of possible demotions, a higher chance of being laid off and fired due to the increased absences, and on that point about the demotions, they are not able to carry more work responsibilities due to the unreliability of the HS flare-ups, again making working more challenging. They're also being called lazy, leading to the inability to perform their best, so again, less chance for promotion, or a higher chance of being considered laid off when the opportunity arises. In severe cases, HS can impair their ability to work entirely, leading them to file for disability benefits. And conversely, certain work-related activities can exacerbate HS symptoms, further highlighting the two-way interaction between disease activity and employment. Long-term sitting, physical exertion, or job-related stress can contribute to flare-ups, making it difficult to control the disease while maintaining employment. This bidirectional relationship between employment and disease management has not been widely reported in literature before, however. So in previous studies, they have shown that there is a significant percentage of individuals with HS experiencing work impairment. Up to 58% are likely to miss work or school, and those who attend see a 20 to 30% reduction in productivity due to the disease. The severity of impairment increases with advanced stages of the disease, so early stages 2 and 3, and people with HS report a higher number of total workdays lost. So, taken directly from Barnes 2023, 18.4 days on average have been missed with those with HS compared to those without, with an average of 7.7 days. Additionally, people with HS seem to be at an increase of leaving the workforce, with an adjusted hazard ratio of about 1.65 compared to those without the condition. This evidence shows that the progressive impact of HS on employment emphasizes the need for flexible work environments and patient-centered care that can accommodate the challenges faced by individuals with HS, while the association between HS activity and work productivity is well documented. This emerging understanding of how employment can influence disease adds another layer of complexity to managing the condition. Now let's focus on how HS affects an individual's social and love life. Firstly, let's look at some statistics in a study about social interaction. So, This is the same study pulled from, I think, Barnes. So out of 415 participants, 354 of those, or around 85% of them, have had their social life impacted by HS in some way. These would either be a barrier to social interactions, inability to be active, and being restricted in their clothing options, as tight-fitting clothing would most likely exacerbate the HS. Many of the participants pointed out that they had to cancel plans at the very last minute because they had flare-ups, leading them to be very unreliable in a lot of friendships, also possibly causing a loss of friendships. This means they cannot plan ahead of time for trips and events. Water activities in particular are the most ruled out for those with HS. This is due to the fear of infections that they could get, because obviously pools are a community thing. You're not sure what's in the water and you're not sure what you're going to release in the water. And the fear also of being questions about the scars and the leakage, and also just the stress of going out does not seem to make it worth socializing with other people. And going off the topic of socializing, it really impacts the love of many individuals, as from that same cohort of individuals, of 415 participants, 360 of them, or 87% of them, believe HS harmed their love life or intimacy, with the main sort of emotions felt being the fear and anxiety of those being intimate with their partner, are the trauma of the previous partner's reaction to the HS, because of the disgust or not understanding how severe it is for HS sufferers. The main sort of reason though is that it's mostly caused by the physical manifestations of HS, such as the constant leaking, open wound, abscesses and boils in many cases, like I've mentioned many times before. Again, going through the personal experiences of many of the participants, as mentioned before, many individuals were traumatized by the reactions of their previous partners. They didn't like receiving constant pity, judgment or hurtful reactions to their HS, and many of their partners automatically assumed that the balls associated with HS that were located in the groin areas especially were STIs. This would obviously be quite insulting and embarrassing for many people. This also turned off their partners because HS were constantly leaking during the intercourse, as well as, I wouldn't want to say it, but the off-putting odor associated, which is just, it's not something to be embarrassed about, but it's just something that does happen. Another thing to note is that sexual intercourse can also lead to flare-ups, as well as such as chafing of the thighs and causing inflammation. The body is also more often than not in too much pain for sexual intercourse. And lastly, the medications used for HS can, as an adverse effect, cause I wouldn't say adverse, but as a side effect, cause a lower sex drive in many individuals. Another sort of main theme associated with those afflicted with HS is the various costs that affects access to patient-centered care. Participants brought up two primary burdens at the time: the time that is required to access care and the financial burden associated with HS. Time-related challenges included coordinating appointments and the travel time needed to reach facilities, not to mention if they had a flare-up on the day of their appointment. This means they'd more often than not have to once again delay their appointment and possibly wasting money on that appointment, as maybe they plan travel to the appointment or would have to pay the cancellation fee. Financial burdens included medical visits, travel expenses, like I said before, medications, and wound care supplies. Over time, the cumulative impact of these costs can be staggering, and this often forces individuals to abandon specific treatments altogether. In extreme cases, these financial pressures can strain household budgets, this basically affecting their essential needs, which ultimately limits access to patient-centered care. Participants also express a preference for providers with specialized HS knowledge. With dermatologists often seen as the most qualified to manage the condition, some individuals specifically sought out HS subspecialists who were knowledgeable about emerging therapies and demonstrated a strong passion for treating HS. In cases where general dermatologists ran out of treatment options, patients were referred to HS-focused specialists. However, due to a shortage of these subspecialists and perceived lack of expertise among general dermatologists, there is a call for expanding HS-related training in residency programs, and this includes didactics and experiential learning. Now, this is more targeted, but for some Black participants, racial concordance with their providers was highly valued in their cases, with Black physicians perceived as more knowledgeable about HS and better equipped to manage complications such as post-inflammatory hyperpigmentation. Because as you can imagine, if you're not too knowledgeable about those with darker skin or high Fitzpatrick skin types, you may not easily see post-inflammatory hyperpigmentation because it is obviously a darkening of your skin cells because, increased melanin deposits, so they wouldn't be able to tell too well unless they're experiencing that type of skin type. One woman especially expressed a preference for female providers after previous experiences of having her pain dismissed by male physicians. Given that HS disproportionately affects Black women, there is a need for dermatologists to consider how implicit bias also may affect the care and pain management of patients with HS. This is also just highlighting the importance of providing equitable and culturally sensitive care to improve treatment outcomes of all individuals with HS. Pain is another theme that's been talked about, and this can be framed in two ways. The actual pain and unpredictability that most HS sufferers have to deal with on a daily basis, and the pain of HS sufferers being minimized and stigmatized when it comes to healthcare providers, as their main focus are the physical manifestations, the biological impacts. However, they fail in most cases to address the psychological impacts as a whole. It is quite common for dermatologists to focus purely on the cosmetic side and not even care about or address the pain in most cases. When it comes to acute care, many health providers, upon requests for opioids to help deal with HS, felt like they were being treated as drug seekers or pill poppers, and due to the fear of being stigmatized, this left many people enduring the severe pain of HS without any interventions at all, actually, which is honestly quite sad. Another interesting thing is that patients were usually responsible for coordinating their own multidisciplinary care, as there seemed to be little communications between providers, which added a loss of time for things like work, socializing, and also the embarrassment of having to retell their story again and again to each new provider that they meet. And finally, the most prevalent theme in all these studies is misdiagnosis. Many individuals experience either misdiagnosis or mismanagement of their HS. This stems from the belief that most providers are usually unaware or have insufficient knowledge when it comes to the diagnosis of HS and the symptoms associated with it. This showed greatly when one particular individual received 13 surgeries over 8 years because of the mismanagement of her HS. Because of the lack of knowledge, because of the lack of knowledge of the medical procedures that could be conducted to relieve the stress of HS, this caused her and many others to basically have an increased feeling of stress and isolation from their peers. Because obviously 13 surgeries means a lot of downtime and constantly hoping for the next surgery would be their last surgery. In their mind, they're like, this is going to fix it, this is going to be the final one to help me, but in reality it did little, maybe some improvements, but ultimately, because it is chronic, it didn't help much. Anyways, yeah, so that's the last theme for today. So thank you for joining me for the third episode of High Densities. Now, I'm not too sure what the next episode will be or if there will be one, but if there is, this is a goodbye for now, and I hope to catch you guys later.